Hello, hello. Thank you guys for tuning in. I'm sorry I am a few minutes late. Many of you know, but I am Dr. McJunkin. I specialize in helping people who have overactive bladder, and I specialize in a procedure called sacral neuromodulation. So it is generally the best, most effective thing for people who are suffering with all of the symptoms of overactive bladder. And those include frequency, going to the bathroom more than 8 times in a 24-hour period, nocturia, getting up more than once per night to go to the bathroom, incontinence, and urgency, having a strong desire to use the bathroom, and only a limited amount of time to get there. So some people have all of that cluster of symptoms, some people have one or two of those. Any of them alone can be devastating. As you start to add those things together, it just gets worse and worse. I just talked to a really nice woman, and she is getting up 4 to 6 times per night, every night, to go to the bathroom. And so that's her biggest complaint. She has an urgency at nighttime. She doesn't have a whole lot of incontinence. So for her, the biggest thing is just trying to get proper sleep quality for her quality of life. And as you can imagine, and it's interesting, the research on not sleeping through the night or waking up more than once per night, the research keeps coming out how dangerous that is for people, and how we need to really try and maximize people's health. One of the other ladies that I talked to recently, she's waking up multiple times a night, and she has an aneurysm in her brain. And so it's been well studied. If you're waking up multiple times a night, basically your body is in an inflammatory state. And that inflammation, remember, at nighttime when we sleep, that should be an anti-inflammatory time, especially for our brains, but also for our body. Our brain's cleaning itself out, our body is healing itself. And for this woman, she has an aneurysm. And really, I was, kind of curious, because I know that, lack of good sleep at nighttime really puts you at an increased risk for heart disease, for stroke, for any other cardiovascular problems. And that's kind of one of the number one killers. It also puts you at a risk for diabetes, and the list goes on and on. But I looked up, in particular, aneurysms, and sure enough, there is a strong link between not sleeping well and aneurysms. And that is something that, I'm very passionate about, getting people quality sleep so that we can prevent some of those really common problems. And I mentioned this prior in another live that we did, but another interesting thing is there is a high correlation with coronary artery disease, which is cardiovascular disease, and overactive bladder. So if you have an overactive bladder, you're really at an increased risk for heart attack. And so it's time to, I always encourage people, it's time to really take control over your health. Because we want to prevent those things from occurring. Okay, I'm going to talk about what are kind of the newest technologies for overactive bladder. And there's 3 of them that I'm going to cover today. And then I'm going to share the data from the studies. And so we'll look at what those studies look at, how they compare to each other. I think 2 of them are not widely available yet. The third one is. And so I'm going to start with this technology called Ecoin. And so this technology, it looks like a little coin. And so it is a leadless tibial nerve stimulation device. Specifically for urgency urinary incontinence. And so the study was a pivotal study. That just means it's the first study looking at this kind of technology. It was published in the Journal of Urology in 2021, had 133 patients. So all of those things so far I really like. They followed the patients out for 1 year. So that's kind of how you should do a pivotal study. You should have a large enough number of people where you can see a significant difference. This device, there wasn't a trial. You didn't try it, but instead they implanted this little device. And basically, I don't know if anyone watched last time, but last time we talked about tibial nerve stimulation. And the tibial nerve runs kind of along the inside part of your foot, just above your ankle, and it streams down there. And what's interesting is the tibial nerve goes up and connects up into the sacral nerves, and we know that that has an effect on bladder function. And so tibial nerve stimulation has been around a long while, and has shown promise and benefit. We talked about the benefit in the last video. This is kind of the next step up. Instead of just going and sticking a needle in there and stimulating the nerve, now we're actually implanting a little coin-sized device kind of over the nerve for these people. Okay, so let's look at this study. And so this is the first technology we're going to talk about. At 48 weeks, or basically the end of this study, there was a baseline of urinary urge incontinence episodes. The baseline was 4.3 as these people came into the study, meaning a little more than 4 times a day they would have a strong urgency and some kind of incontinence episode. Remember, this is 133 people, so someone might have 6 of those episodes and someone else might have 1. And what they found is this technology reduced the number of urinary urge episodes per day by 2.6. And so so that is a little bit more than half. So their baseline was 4.3, reduction by 2.6, and so half would be 2.1. So this reduced it more than half. And then for voids, so let's say frequency was your problem and you're going 15 times a day, it reduced the number of episodes that you're going 2.12 times per day. So that's, maybe not, I don't know if that's enough to drive the needle for most people. I think the incontinence would be a better indicator. But again, it's a little more than 50%, but it's not up to like a 75% or anything like that. And in fact, that number, 68% of the patients in their study experienced a 50% reduction in urinary urge incontinence episodes at 48 weeks. So we're getting close to 70%, so that means most of the people had some kind of a benefit. And then nocturia. This is really, I just told you about the woman who's getting up kind of 4 to 6 times a night. Baseline nocturia was 2.5. And again, that just means some of the people were getting up 5 times a night, maybe someone else 0 times a night, but on average 2.5. This reduced the number of nighttime episodes by 0.51. So what that means is, let's say you were the person who was getting up 3 times a night. Now every other night you might be getting up twice a night, if that makes sense. So again, I think there is a benefit there. It may not be a significant benefit. And so that technology is called the Ecoin, and the company that makes it is Valencia Technology. I think one of the cons of this device is 16% of people experience a device-related problem. And that's actually a pretty high number. That could be for a couple different reasons, but one of the reasons I believe that this is the implanting physicians generally were urologists, and so they didn't have as much probably experience in the ankle doing surgery there, identifying the nerve, placing this over the nerve. And so I think that led to probably more issues. It doesn't say exactly what the device-related problems were, but generally, from doing a lot of different research studies, pain at the device site would be a really common one. Infection would be another one. Device movement, where it moves from the place it's supposed to be. The problem with this one is if it moves, it's not stimulating the nerve. And so 16% is a really high number. I would imagine as this device becomes more widely used and as you get some doctors who become very skilled in that, that number would go down below 16% of people. So interesting technology. I'll put a link of what that looks like. And clearly their kind of best thing that it did was reduce the number of urge incontinence episodes by 50% or more, and 68% of people, or roughly 70% of people, experience that. So, clearly this would be beneficial for a lot of people, maybe not in the life-changing category. Okay, so we're going to look at another technology. So that was number one, the Ecoin. Number two is called Blue Wind. And so this is another technology, actually very similar to Ecoin. It's a miniature implantable device. It goes on the tibial nerve as well. So they have a study, miniature implantable tibial neuromodulation device for management of overactive bladder complaints. There were 36 people implanted, and 34 of the people completed the study at 6 months. So, if we were comparing these two studies, obviously the Ecoin has more people in it. The blue one, that's not a lot of people. Clinical success was defined as more than 50% reduction in the number of leaks per day, or number of voids per day, or number of episodes with degree of urgency more than 2, or a return of less than 8 voids per day on a 3-day diary. And so I don't love this study because I feel like it wasn't real clear what their endpoint is. Like, their endpoint is like, if one person gets any of these things, we consider it a success. And that seems a little too broad. I think if you were just purely looking at leaks per day improvement and you're looking for a 50% improvement, that makes sense. But it's kind of hard to say we consider success if they have a 50% improvement in anything. So I personally do not love this. And so what generally that might mean for a study is it might show a higher success rate than people in the real world would actually get with the device. So this study is also only for 6 months, where the previous study was 12 months. So again, not as long. 71% of people experience clinical success. Remember, clinical success was that whole list of things. This company also did a 3-year follow-up. So I do like that because they're following up with their patients for 3 years and following up the results. Remember, there was 34 patients who started the study. And then they ended up with only 20 patients at 3 year. And so again, this happens in research studies. That's a really high number to fall out of the study. And so meaning, the device got removed, they did not have benefit, they didn't want to be a part of the study anymore at all, they couldn't get a hold of the person moved, all sorts of different things could account for that. But it's a really high number of people were not available 3 years. So also what this should tell us is at 3 years, the people who stuck around were probably getting benefit, right? The people who weren't likely weren't. So we're going to look at that. So overall treatment success was 75% at 36 months. So remember, we said it just a bit ago, we said it was 71% successful at 6 months. So again, what this means is we're kind of cherry picking people here at this point. 75% of people at 36 months. And again, remember, this is really wide open for what was considered success. 73% of people reported improvements in health-related quality of life difference. And then I think Blue went on to do a larger study of the 151 patients, and I don't know if the results for that are quite published yet. So that one will be, one that we'd want to follow. Again, I don't know if this device is available yet. I have talked to one of the early representatives for this company who was promoting it, but I'm not sure if it's quite available yet. And I'd be much more interested in that larger study, 151 patients, and then much more interested in how those people do, let's say, at least 1 year is probably the minimum number, and then hopefully they can keep those patients in the study. Okay. The last study that I wanted to cover is actually the technology that I utilize. And so this is called the Axonics Sacral Neuromodulation. This one has been done, it was FDA approved 4 years ago, so it's actually been done a lot more than the other technologies. The underlying technology has been out for a little over 25 years, so it's not new. It's not necessarily new surgical techniques. The device now is just smaller, has been refined, the way that they use electrical energy. So this device is called Sacral Neuromodulation, but essentially it's a miniature little pacemaker that goes under the skin. Again, I'll post the link what that looks like. It's hooked into a wire that goes down right next to one of the sacral nerves. So it's actually outside your spinal canal, but the sacral nerves are more of like the roots that go to your bladder and go up to your brain. So let's look at their study. So they have a 2-year outcome study called the Artisan Sacral Neuromodulation Study. They had 129 people originally enroll in the study. At 2 years, 121% of people were still available, so that's really good. 93% of responders. Okay, let's see. 93% of those people had more than a 50% reduction in urinary urge incontinence. So, what this is telling me is this technology seems to be more effective than those other two technologies. Because both of those technologies, even if we took them at face value, the first one, had 133 patients, so that's about the same size study. But that one had 68% of people had a 50% improvement. This one has 93% of people have a 50% reduction. So that's actually a massive difference. So if you were going to get one technology, this would be the one if you were just looking at the research data, what it could do for you. On average, there was a 75% reduction in urinary urge incontinence episodes across all study patients. And this is what I actually tell most people is we expect that you'll get about a 75% improvement in your symptoms. That's the average. Now, some people will get 100%, some people will get 50%. There are some people who just do not get relief. This one is unique or different than those other two, and the fact that there's a trial for this. So you actually try it out first, make sure the technology works for you. If it does, then you get the little implant procedure. My suspicion is all of these procedures probably take about the same amount of time for somebody who's skilled to implant the device, and I would say usually that's somewhere between 25 and 35 minutes. For people who do this frequently. So a little more into the study, the daily urinary urge incontinence episodes decreased from 5.6 at baseline to 1 at 2 years. So what that means is, on average, people had 5.6 episodes of urinary incontinence episodes per day. Okay. And I'm going to compare this to that other study that we know the data on. This decreased to 1 of those episodes per day at 2 years. So that's actually a massive improvement. Going back to look at the other study, okay, so they had 4.3 urinary urge incontinent episodes per day. So they had less in the Ecoin study, and it was reduced to 2.6. So remember we said it was a little more than 50%. This one would be more than 75 or 80%. So it's a really significant difference. 80% of people at baseline had more than 8 urinary episodes per day, or frequency. So 80% of people had a frequency problem, and the average was 11.6 per day. With this study, at 2 years, it was reduced down to 8.6. So, and remember, less than equal or less than 8 is considered normal. So essentially, these people were almost normal. Again, that was more of a significant reduction in those episodes per day. And then this is a really good one, I think. Large leaks. So 76 people at 2 years had these large leaks. 76 of their people in the 129 group of patients had large leaks where their whole bladder would go. And so this one's really interesting. This happened at baseline to 1.6 times per day for those people who had this. So that means, 1.5 times a day, or, that you would have the full release of your bladder. That got decreased to 0.1 at 2 years. And so what that means is instead of having this happen 1.5 times per day, now all of a sudden it's happening once every 10 days. So that's a really massive improvement. And then they have some satisfaction score of 94%. So 94% of the people in their study were satisfied and felt like there was a difference in their quality of life. So those are kind of the 3 latest and greatest technologies for overactive bladder. These are all implantable devices. All of these are cutting edge. I don't know if those first 2 are widely available right now, but we looked at Ecoin, we looked at Blue Wind, and then we looked at Axonics. In that study, Axonics was clearly the leader with clearly the best results compared to the other 2. We will see if there's a place for those other 2 in the market. To me, those do not necessarily seem less invasive than the Axonics technology. All of them are stimulating peripheral nerves, so all of them are outside the spinal canal. Okay, that is our review today of the best technologies. Again, if you have a problem with overactive bladder, if you're waking up frequently at night to go to the bathroom, if you're going frequently throughout the day, if you have a strong urgency to go and can't hold it and have incontinence, if you have all of those or any of those, I would say give us a call. We're at Bladder Centers of America. This is what I specialize in. I love it because it works so well for people. And so many people call this their bladder miracle. We may not get 100% relief, but what we're shooting for is 75% relief or more of your symptoms. And for most people, that ends up being very, very significant. So far, in the past few weeks, we have compared medications to this kind of technology. We've compared other types of technology. So one was the Imsala chair that gives stimulation. One was tibial nerve stimulation. One was almost like a TENS unit in the perineal area. And now we've looked at 3 different implantable devices. And if you've looked at some of those videos, I've tried to do a good job of really just looking at what the research shows, because it's really important. All these companies are likely very good at marketing, but what we want to know is what is a real person expect to get? What is the real benefit that you can expect? And I absolutely love what we do because it is just life-changing for people. Okay, thank you guys for watching. If you have any ideas for topics or what you'd like to discuss, I'd love to hear about it. If you have thoughts or comments, I'd love to hear about those. I'm going to send over the show notes that has all these different studies and also has images of what that technology looks like. Okay, have a wonderful week, and God bless you guys. Thank you so much.